हम फर्स्ट सेकंड वेव के टाइम के भी पूरा वो जो भी टाइम पे लेना वो डिस्टेंस ले लिए, सक्सेसफुली इम्प्लीमेंट करे। आपको सेकंड वेव का टाइम पे आप दूसरा स्टेट्स का हालत देखे, अपना तेलंगाना स्टेट का हालत क्या है आपको मालूम है। ओके, वैसा पैनिक सिचुएशन कभी भी नहीं है तेलंगाना स्टेट में। हमारा स्टेट में कभी भी ऑक्सीजन के लिए प्रॉब्लम नहीं हुआ। बगैर ऑक्सीजन के वजह से कोई भी क्या बोलते हैं नहीं मरे, मरीज तो नहीं हुआ कोई भी। ओके, हॉस्पिटल बेड्स का स्केर्सिटी कभी भी नहीं हुआ। अब बाजू स्टेट्स देख लीजिए,
मरने का इंतजार कर रहे हैं क्या बोलते मेरा सवाल।
ऐसा नहीं है, बिल्कुल नहीं है। वैसा बोले तो मेरे को भी वही सवाल आता ना। हाँ, okay, thank you. And especially the last 3 days the cases are increasing in many folds, especially in the GHMC area, Hyderabad, Rangareddy and Medchal. So we request the people not to be panicked, but it's high time to be more alert and more attentive with related to the COVID appropriate behavior. So now in the coming days, maybe in the next 4 weeks, we are going to see a surge in the country and also in the state, because the same trends are going on across the world. So for this, today we are giving around 9 commandments to the people of Telangana. We request you to wear the mask both inside and outside, and also not to participate in the large gatherings, and try to spend more time in the more ventilated spaces, and also maintain physical distancing. And moreover, if you find any symptoms, the mild symptoms or any such kind of symptoms with related to COVID, you please visit to the nearest government health facility for testing. And once you are diagnosed, you try to follow the doctor's instructions along with the COVID home isolation kits. And most of the people in this third wave time require home isolation, because almost 90% population required only home isolation, and rest of the 9% people who are having mild symptoms also can manage themselves with the home care kit at their home itself. And also, if somebody is not vaccinated till now, whether it's the first dose or second dose, you please go to the nearest vaccination booth and get the job done. And in the coming days also, there are so many festivals are coming, especially in Telangana, like Sankranti and other festivals. And also there will be a lot of traveling will be happening. So my request, if it is required, only you have the travel. So otherwise, try to spend or celebrate these festivals along with your family members. And also with related to the admissions. Now, due to the panicness or other apprehensions, people are, once they are found positive, people are immediately going to the hospitals to get themselves admitted. My request, humble request to all of them is, now not even 0.5% people are required in the hospital admissions in this third wave are due to the Omicron, being the most of the people are having either asymptomatic or mild symptomatic. Okay, only with the hospital doctor's advice only, you please get yourself admitted. And also with related to the treatment protocols. Now the Government of India has given lot of treatment protocols, and the other doctors also to adhere these Government of India issued protocols. Now we have seen lot of new medicine for the last 2 years with related to the treatment of the COVID, starting from the monoclonal antibodies or the new advanced drug molnupiravir. Okay, so these are not that much effective as far as this COVID is concerned, because we have to manage the symptomatics and with the mild symptoms. So we could able to manage all these symptoms with this minor or symptomatic drugs. So my request to all the private hospitals also not to go with the high-end treatments for this patient unless it is desired to save the lives of the people.
Sir, in regard
required, only the 7 days isolation is required. Once the fever or other symptoms subsides, after 3 days you can go out and just to wear the mask.
Sir, has the Omicron replaced Delta and community transmission of Omicron has started in the state
Definitely,
of Telangana?
that is we are seeing, we are witnessing. Definitely.
Sir, molnupiravir is the drug that has been given.
Yesterday,
approval from
ICMR DG has clearly clarified the molnupiravir drug is having lot of side effects. Okay, it is not completely proven. It might, the DCJ might have given permission for the usage of the drug, but it is the discretion of the doctor whether can be used for the individual patient or not. Okay, so we should be very cautious and careful while using the cocktail. Now we know that it is very ineffective, Now it has become now everybody, whoever becomes positive, they want to just go and admit in the hospital and get a cocktail dose. That is not the solution. Okay, it is not going to help in any way unless again it will create more problems. Okay, it is a similar case with the molnupiravir also. This thing. Next coming 4 weeks are going to be very, very crucial, very, very sensitive with related to the public health. There is a serious surge in the cases. So my humble request all the political leaders and political parties to suspend all the political activities in the coming next 4 weeks
Sir,
in view of the public health interest.
Duties of healthcare workers, sir, you stated that there is no...
Already we have cancelled all the leaves of my public health care workers, and if somebody is on leave also, those leaves are going to be cancelled. Okay, now it's time to dedicate our services to the people's health. My dear friend, please, my dear friend, please understand.
New Year
First of
celebrations
all, as far as the health department is concerned, we are taking all measures. For those things, there are certain appropriate authorities are there. You can ask them. I'm not the right person. I'm not everything in the government. That please understand. We all know. ఇప్పుడు రోడ్డు మీద వెళ్తూ ఉంటాం, వెహికల్స్ ఎదురుగా వస్తుంటాయి, మనం పక్క తప్పుకుంటేనే మన ప్రాణాలు ఉంటాయని మనకు విషయం తెలుసు. ఓకే, అలా అని చెప్పేసి అలాగ వెహికల్కి ఎదురుగా వెళ్తామా ప్రాణాలు తీసుకోవడానికి? ఇది కూడా అంతే, మనకి తెలుసు ఇప్పుడు కేసెస్ పెరుగుతున్నాయి. ఇప్పుడు మనం ఏం చేసుకోవాలి? అసలు ఎలాంటి రిస్ట్రిక్షన్స్ లేకుండా మీరు 100% మాస్క్ పెట్టుకోవడం ద్వారా ఎలాంటి వేవ్స్ లేకుండా ఎలాంటి సజ్జ లేకుండా చూసుకోవాలి. ఆర్ ఎవ్రీ సిటిజన్ ఈజ్ ఫాలోయింగ్ దట్ ప్లీజ్ అండర్స్టాండ్. అండ్ వీఆర్ రిక్వెస్టింగ్ దెమ్ టు అవాయిడ్ ద గ్యాదరింగ్స్. Is it not the family or family head responsibility? This is the time we should not go to theatres. This is the time we should not go to the park. This is the time we should not travel. Okay, so why we are not thinking in those lines? That's my concern. You think that everything government will come and tell? You think that everything government has to take a call and impose? Now the situation is not alarming. Please understand. We are not here to make people panic. We are here to tell precautions, what kind of precautions they should take. So this is, please understand.
Sir, government employees